The proposals in H.R. 3799 are yet another recycled, futile attempt to sabotage the Affordable Care Act and actually make it harder for workers and families to find affordable, high-quality health insurance. This legislative package includes two bills that were marked up by the Committee on Education and the Workforce. First is the Association Health Plans Act. This act undermines the core promise of the ACA, access to affordable health care for all. The faulty legislation may provide lower costs for some enrollees, but it would do so by skimping on benefits and increasing costs for everybody else. Specifically, the bill would allow association plans to cherry-pick low-risk young individuals for a pool separate from the ACA marketplace. You may hear my colleagues on the other side of the aisle tout the bill's nominal protections against discrimination based on pre-existing conditions. They omit the details regarding other large loopholes that leave consumers vulnerable to this bill, such as charging higher risk groups more so that the plan will not be attractive to them, and low risk groups charge them less so that they'll be the ones that come in. In fact, this legislation explicitly authorizes HPs to set premiums based on, quote, specific risk profile of employer members, enabling them to charge higher premiums to groups based on their age, gender, and other factors. HPs could also exclude certain categories of coverage, such as maternity care, mental health, or substance abuse disorder, to dissuade certain groups or individuals from enrolling. And under the bill, association plans could also evade essential health benefits and other consumer protections under state and federal law. So it is a bad idea because of simple arithmetic. If healthy, low-risk individuals can leave the Affordable Care Act marketplace risk pool, join a separate association, and pay lower rates, on average, those that did not get into these plans will, on average, pay higher premiums. Let's be clear. Let's be clear. Only low-cost groups will be in these plans, because if you're a high-risk group, the cost will be too much and it will not be attractive. If they are higher-risk groups, the pre-existing conditions, older groups and whatnot, they will not be able to form groups that charge less than the ACA marketplace, and nobody will want to join. So under the ACA, everybody pays average. You got a pre-existing condition, not a pre-existing condition, everybody pays the same, and everybody gets insurance at an affordable cost. And everybody enjoys all of the essential benefits under the ACA. But association plans, for example, do not have to provide coverage for essential benefits, like maternity benefits. So all of the costs of maternity care will be borne by fewer and fewer people. The average cost of insurance for those not in the plan will slowly grow as the number of association plans grow. So various versions of this legislation have been pushed for Republicans for decades, but all iterations suffer from the same fundamental flaw, that they shift costs to the most vulnerable. That's why 30 leading consumer and patient groups have expressed serious concerns with this harmful legislation. The other bill marked up in Education and the Workforce was the Self-Insurance Protection Act, legislation that further erodes the ACA by exempting stop-loss insurance from key consumer protections. The bill would prevent Secretaries of Health and Human Services, Labor, and the Treasury from regulating stop-loss insurance coverage. And even more troubling, the bill makes it virtually impossible for states to protect consumers from abusive practices by invalidating state laws that regulate stop-loss. Now, stop-loss insurance usually covers costs above a catastrophic level, say over $1 million or something like that. But they can be written to say cover everything over $1,000 when they become essentially regular insurance, except that they're not regulated. No solvency regulations, no benefit regulations, no nothing. So we can all agree that small businesses and self-insured people deserve access to affordable health care That's what you get under the Affordable Care Act. But we should also agree that people deserve basic consumer protections to ensure that they have insurance with quality, solvency, an agency to call if something goes wrong, and coverage for essential benefits. That's why we passed the Affordable Care Act in the first place, and why, when Democrats were in charge of the last Congress, we passed the American Rescue Plan and the Inflation Reduction Act to make coverage even more affordable. So the question before us is, do we want to make sure that every individual can continue to find affordable and quality health care coverage, or do we want to pass H.R. 3799 and create roadblocks for Americans seeking care? I would hope that we would oppose this bill and reserve the balance of my time.